Today I am going to teach you about prevention of disorders and promotion of various wellness programs. After I teach you this module, you shall be able to know about the prevention of disorders and promotion of wellness programs. You will also know about the various ways of preventing disorders, the various risk and protect factors contributing to promotion. You will be able to also evaluate whether the promotion and prevention are as effective as they are supposed to be, and also analyze the roles of each of the promoting wellness and preventing disorder program. Let me introduce to you what a mental disorder is. A mental disorder, which is also called mental illness or psychological disorder or psychiatric disorder, is a mental or behavioral pattern that causes either suffering or a poor ability to function in ordinary life. Many disorders are described. Conditions that are excluded include social norms. Signs and symptoms depend on specific disorder. The causes of mental disorders are often very unclear. Theories may incorporate findings from a various range of fields. Mental orders are usually defined by a combination of how a person feels, acts, thinks or perceives. They may be associated with particular regions or functions of the brain, often in a social context. A mental disorder is one aspect of mental health. The scientific study of mental disorders is called psychopathology. Services are based in psychiatric hospitals or in the community, and assessments are carried out by psychiatrists, clinical psychologists and clinical social workers using various methods, but often relying on observation and questioning. Treatments are provided by various mental health professionals. Psychotherapy and psychiatric medication are two major treatment options. Other treatments include social interventions, peer support and self-help. In a minority of cases, there might be involuntary detention or treatment. Prevention programs have been shown to reduce depression. Common mental disorders include depression, which affects about 400 million, dementia, which affects about 35 million people, and schizophrenia, which affects about 21 billion people globally. Stigma and discrimination can add to the suffering and disability associated with mental disorders, leading to various social movements attempting to increase understanding and challenge social exclusion. The definition and classification of mental disorders are key issues for researchers as well as service providers and those who may be diagnosed. For a mental state to classify as a disorder, it generally needs to cause dysfunction. Most international clinical documents use the term mental disorder, while illness is also used quite commonly. It has been noted that using the term mental, that is the mind, is not necessarily meant to imply separateness from brain or body. According to DSM-4, a mental disorder is a psychological syndrome or pattern which occurs in an individual and causes distress via a painful symptom or disability, or it increases the risk of death, pain or disability. However, it excludes normal responses such as grief from the loss of a loved one, and also excludes deviant behavior for political, religious or societal reasons not arising from a dysfunction in the individual. DSM-4 precedes a definition with caveats, stating that, as in the case with many medical terms, mental disorder lacks a consistent operational definition that covers all situations, noting that different levels of abstraction can be used for medical definitions, including pathology, symptomatology, deviance from a normal range or etiology, and the same is true for mental disorders, so that sometimes one type of definition is appropriate and sometimes another, depending on the situation. Mental disorders are generally defined by a combination of how a person feels, acts, thinks, or perceives. This may be associated with particular regions or functions of the brain or rest of the nervous system, often in a social context. The recognition and understanding of mental health conditions have changed over time and across cultures, and there are still variations in definition, assessment, and classification, although standard guideline criteria are widely used. In many cases, there appears to be a continuum between mental health and mental illness, making the diagnosis quite complex. Thus, prevention of mental disorder is very necessary. Now, what does prevention mean? Prevention means those interventions that are targeted at a general public or to a whole population group that has not been identified on the basis of increased risk. Prevention of disorder, the potential and possibilities for prevention of mental and behavioral disorders have increased substantially in recent years. Universal, selective, and indicated preventive interventions are included within primary prevention. Universal prevention targets the general public or a whole population group that has not been identified on the basis of increased risk. Selective prevention targets individuals on subgroups of the population whose risk of developing a mental disorder is significantly higher than the average, as evidenced by biological, psychological, or social risk factors. Indicated prevention targets high risk people who are identified as having minimal but detectable signs or symptoms foreshadowing mental disorder or biological markers indicating predisposition for mental disorder, but who do not meet diagnostic criteria for disorder at that time. Secondary prevention seeks to lower the rate of established cases of disorder or illness in the population, that is the prevalence, through early detection and treatment of diagnosable diseases. Tertiary prevention includes intervention that reduces disability, enhances rehabilitation, and prevents relapses and recurrences of the disease or the problem. Moving on to the prevention of disorders, let us talk about the biological interventions first. Long range of medical measures such as emergency care for a hypertensive crisis or bypass surgery or coronary heart disease, good clinical practice requires that patients receive adequate biological help for treatment. Biological psychiatry or biopsychiatry is an approach to psychiatry that aims to understand mental disorder in terms of the biological functions of the nervous system. It is interdisciplinary in its approach and draws on sciences such as neuroscience, psychopharmacology, biochemistry, genetics, epigenetics, and physiology to investigate the biological basis of behavior and psychopathology. Biological psychiatry and other approaches to mental illness are not mutually exclusive, but may simply attempt to deal with the phenomena at different levels of explanation. Because of the focus on the biological function of the nervous system, however, biological psychiatry has been particularly important in developing and prescribing drug-based treatments for mental disorders. Next, we talk about psychological interventions. Even though psychoanalytic theory has long emphasized associations between physical illness and emotions, psychotherapy has been largely effective in treating psychophysical disorders. Biofeedback. Biofeedback is the process which is gaining greater awareness of many physiological functions, primarily using instruments that provide information on the activity of those same systems with the goal of being able to manipulate them at will. Bill Bomber in 1993 has reported impressive effectiveness, especially in long-term follow-up for electromyography biofeedback in musculoskeletal. Moving on to CBT, which is cognitive behavior therapy. Cognitive behavior therapy is a form of psychotherapy. It is originally designed to treat depression, but now it is now being used for a number of mental illnesses. It works to solve current problems and change unhelpful thinking and behavior. The name itself refers to behavior therapy, cognitive therapy, and a therapy based on a combination of basic behavioral and cognitive principles. Most therapists working with patients dealing with anxiety and depression use a blend of cognitive and behavioral therapy. This technique acknowledges that there may be behaviors that cannot be controlled through rational thought, but rather emerge based on prior conditioning from the environment and other external or internal stimuli. CBT is problem focused, that is, it is undertaken for specific problems, and it is action oriented. That means the therapist tries to assist the clients in selecting specific strategies to help address those problems, or it is directive in its therapeutic approach. It is different from the more traditional psychoanalytical approach where therapists look for unconscious meaning behind behaviors and then diagnose the patient. Instead, behaviorists believe that disorders such as depression have to do with the relationship between a feared stimulus and an avoidance response, resulting in a conditioned fear, much like Ivan Pavlov. Cognitive therapists believe that conscious thoughts could influence a person's behavior all on its own. Ultimately, the two theories were combined to create what we now know as the cognitive behavioral therapy, CBT. CBT is effective for a variety of conditions, including mood, anxiety, personality, eating, addiction, dependence, tic, and psychotic disorders. Many CBT treatment programs have been evaluated for symptom-based diagnosis and have been favored over approaches such as the psychodynamic treatments. However, other researchers have questioned the validity of such claims to superiority over other forms of treatment. Moving on to promotion of wellness programs. But before we talk about wellness programs, we have to understand what wellness is all about. It is a lifestyle, a way of living that encourages good physical and mental health. It is a balanced lifestyle that includes an emphasis on the body, mind, and spirit. Hope, also known as the art of positive thinking, is helpful to many, particularly in the pursuit of wellness. Hope, often used as a noun, is also an important verb for anyone in need of improved health or overall wellness. It denotes action on the part of an individual, that is, to engage in positive thinking. The act of hoping can change your body chemistry to promote endorphins, the release of which can relieve unwanted stress that is harmful to your health and to your well-being. Risk and protective factors. Risk factors are associated with an increased probability of onset, greater severity, or longer duration of major health problems. Protective factors refer to conditions that improve people's resistance to risk factors and disorders. They have been defined as those factors that modify, ameliorate, or alter a person's response to environmental hazard that predisposes to a maladaptive outcome. There is a strong evidence on risk and protective factors and their links to the development of mental disorders. Both risk and protective factors can be individual, they can be family oriented, social, economic or environmental in nature. Mostly, it is the cumulative effect of the presence of multiple risk factors, the lack of protective factors and the interplay of risk and protective situations that predisposes individuals to move from a mentally healthy condition to increased vulnerability and then to a mental problem and finally to a full-blown disorder. Major socio-economic and environmental determinants for mental health are related to macro issues such as poverty, war and inequity. For example, poor people often live without the basic freedoms of security, action and choice than the better offs who take it for granted. They lack adequate food, shelter, education and health. Deprivations keep them from leading the kind of life that everyone actually values. Populations living in poor socio-economic circumstances are at an increased risk for poor mental health, depression and lower subjective well-being. Other macro factors such as urbanization, war and displacement, racial discrimination and economic instability have been linked to increased levels of psychiatric symptoms and psychiatric morbidity. There is a requirement of major understanding between different mental disorders and between mental health and physical health and the developmental pathways of generic and disease specific risk factors leading to mental ill health. However, there is sufficient evidence to warrant governmental and non-governmental investments in the development, discrimination and implementation of evidence-based programs and policies. Those interventions that address risk and protective factors with a large impact or that are common to a range of related problems, including social and economic ones, will be most cost effective and attractive to policymakers and other stakeholders. Let's now talk about promotion aims at reducing stress and enhancing resilience. First and foremost comes to improving nutrition. There is a very strong evidence that improving nutrition and development in socio-economically disadvantaged children can lead to healthy cognitive development, also to improved educational outcomes and reduce risk for mental ill health, especially for those at risk or those who are living in impoverished communities. The most effective intervention models are those that include complementary feeding, growth monitoring and promotion. These models combine nutritional interventions such as food supplementation with counseling and psychosocial care, example warmth, attentive listening. Growth charts which plot the weight of the child against the expected weight have also been suggested to be cost effective. In addition, iodine plays a key role in preventing mental and physical retardation and impairment in learning ability. Iodine supplementation programs which iodize salt or water ensure that children obtain adequate levels of iodine. Global efforts such as those supported by the United Nations Children's Fund have led to 70% of the world's households using iodized salt. This protects 91 million newborns from iodine deficiency and indirectly prevents related mental and physical health problems. Next important factor from nutrition is reducing poverty. Poor housing has been seen as an indicator of poverty and targeted to improve public health and reduce inequalities in health. A recent systematic view on the health effects of housing improvement suggests a promising impact on physical and mental health outcomes. This includes improvements in self-reported physical and mental health and less mental health strain, as well as broader positive social impacts on factors such as perceptions of safety, crime, and social and community participation. The next important point is improving literacy rates. Low literacy and low levels of education are major social problems in many countries, particularly in South Asia and Sub-Saharan Africa, and tend to be more common in women. Lack of education severely limits the ability of individuals to access economic entitlements. While there have been impressive gains in improving literacy levels in most countries through better educational programs targeting children, there is much less effort directed at today's adult illiterates. It is expected that programs aimed at improving literacy, in particular targeting adults, may have tangible benefits in reducing psychological strain and promoting mental health. Ethnographic research in India, for example, has noted that literacy programs have significant consequences beyond the acquisition of specific skills. By bringing women together in new social forms that provided them with information about and ideas from wider world, the classes were potential catalysts for social change. By participating in campaigns as volunteer teachers, impoverished illiterate women and girls gained a sense of pride, self-worth and purpose. The positive mental health impact was mediated through a number of pathways, including acquisition of numeracy skills which reduce the risk of being cheated, greater confidence in expressing one's rights, and a reduction of barriers to accessing opportunities. All these outcomes have been associated with protection against mental ill health and reducing the risk of mental disorders. Now I am going to talk about roles and responsibility of health professionals in promoting wellness. Mental health professionals, including psychiatrists, psychologists, psychiatric nurses, social workers and other professionals with training in mental health, can and need to play a variety of roles to make prevention of mental and behavioral disorders a reality. These can be briefly summarized as follows. As advocates, mental health professionals are well placed to increase awareness and information on prevention among policymakers, other professionals and the general population to create an environment that is more conducive to prevention efforts. Mental disorders are currently widely understood to be without recognizable causes and generally they are non-preventable. Correct information on the known causes and possible methods to decrease the incidence and improve the course of mental disorders needs to be made available widely to remove these myths. Secondly, they play the role of a technical advisor. The possibilities for this role are enormous since most countries and communities have public health and social programs that can serve the cause of prevention of mental disorders. Even if no changes are needed and awareness into the program may be having an impact on prevention of mental disorders, it helps to reinforce the need for the program to be continued or to be expanded. It can also work as leaders or collaborators in prevention program. In many cases, mental health professionals need to take an active role in initiating prevention program. This role can be that of a leader or as an active collaborator, especially in an intersectional program. Some of the most effective prevention programs have been initiated by mental health professionals working in close collaboration with other professionals. Finally, mental health professionals can work as professional care providers. They can come in close contact with people with mental disorders and their families. The opportunities for primary prevention in these settings are enormous. People with one or more mental disorders, either active or in remission, are more likely to develop another mental disorder. Preventive intervention among these people, even though they may be in contact with mental health professionals, are often ignored. Examples include prevention of depression among people with a substance use disorder or of emotional disorders in a child with a specific developmental disorder. Let me summarize what I have taught you today. Prevention of mental disorders is a public health priority. In view of the high and increasing burden of mental and behavioral disorders and the recognized limitations in their treatment, the only sustainable method for reducing their burden is prevention. Prevention of mental disorders and mental health promotion needs to be an integral part of public health and health promotion policies at local and national level. Prevention and promotion of mental health should be integrated within a public policy approach that encompasses horizontal action through different public sectors such as environment, housing, social welfare, labor and employment, education, criminal justice and human rights. Hence, I can conclude that mental health is an aspect integrated with promotional activities and wellness of programs that include various protective factors as well as reduction in stress and enhancing resilience.